Well, welcome back to News 8 Now this morning. After that CBS special report on the Pope's passing, we will have more coverage on that shortly. But for now, we will get into your morning medical news. Measles is spreading in the U.S. Officials have confirmed more than 800 cases of the disease in 25 states. Texas has by far the most cases, although concentrated outbreaks were also reported in New Mexico and Oklahoma. The U.S. had declared measles eliminated in 2000. The Justice Department is now defending the Affordable Care Act before the Supreme Court. This is quite a contrast from Trump's first term, when his administration repeatedly tried to repeal the law. Later today, the justices will consider the legality of certain no-cost sharing coverage mandates, but the people suing argue the mandates are unconstitutional because the recommendations come from an independent task force that the Senate did not confirm. Taking fast walks could help your heart health. Researchers say people who stroll at a brisk pace have at least a 35% lower risk of suffering heart rhythm abnormalities compared to slow walkers. Roughly 60 million people have atrial fibrillation, according to a worldwide study done in 2024. Health officials say that condition can lead to a greater chance of suffering strokes and heart attacks. Up to 3 million Americans are estimated to have inflammatory bowel disease. CDC data shows these diseases are becoming more common in the U.S. Treatments can bring significant relief, but you have to be diagnosed first. Mandy Gaither has the warning signs.
It's a disease that sparks the body's immune system to attack healthy cells in the intestines. While the cause of inflammatory bowel disease isn't fully known, it's believed to be the result of both genetic and environmental factors.
And as of today, it's still what we would call an incurable disease.
Gastroenterologist Dr. Bill Fabian with Mayo Clinic says warning signs include diarrhea, bloody stools, abdominal cramping, pain while eating, unintentional weight loss, low-grade fevers, fatigue, and joint pain.
Loose stools more than 3 times a day. And if you have diarrhea for longer than probably 2 weeks, you probably should go talk to your doctor.
While inflammatory bowel disease is a group of lifelong diseases, the main types are Crohn's disease and ulcerative colitis, which affects only the colon and rectum.
Crohn's disease and ulcerative colitis are slightly different in that Crohn's disease can affect anywhere from the mouth all the way down to the anus.
Diet doesn't cause the condition itself, but some foods like those that are high in fat or ultra-processed can trigger symptoms. Fabian says there are also a number of therapies, including emerging ones, that can bring symptom relief.
We've never had as many options for a newly diagnosed patient with inflammatory bowel disease now as we ever have.
The organization says IBD patients are also more likely to have other chronic conditions.